because you'll be able to identify your client's affect and thereby be able to know how to work with them. It's very direct, very effective. And then we progress it to the completion of that idea that each one of these could be seen to be a strategy that's available. And John Hewling's Jackson quotation from cited by Porges, the higher nervous system arrangements inhibit or control the lower, and thus when the higher are suddenly rendered functionless, the lower rise in activity. And what this means is that if you have a stress, you will try your newest strategies first. And if they don't work, you'll try your next ones. And if that doesn't work, you'll try your last ones. And if that doesn't work, you're at high risk. This is a serious situation. Prolonged parasympathetic states such as shock are dangerous, as we know. So let's think of it in this way. When you see your clients, you can probably tell if they're in an alarm-orient fight-flight. That means they'll be agitated. Or if they're in a flat affect or depressed, reporting depression, that means their social and their sympathetic cards have already been compromised. And all they have left is their parasympathetic. And your job as a therapist, more than any other, is to restore the blue card. More than anything else, because the blue card is kind of a trump card for the whole system. When the blue card is working, everything else falls back into place. It's not like the yellow card, the sympathetic nervous system was removed surgically from the system. The anatomy of it is still there. It's just dormant because at some point in the past it didn't work. So our job, if we can, let's restore the social nervous system card, this third branch of the autonomic nervous system, the so-called ventral vagal, the nucleus ambiguous branch. It's been proposed that the recoverability from trauma is a function of the severity of the incident and the age in which it happened. And the characteristic, the hallmark, the signature for recoverability is, was betrayal involved? If betrayal was involved, it's known to have a very high impact. It's very hard to recover from a trauma that had betrayal involved in it. And see how that would make sense in terms of Jackson's theory of dissolution. Because if betrayal is involved, then the blue, the social, the newest, best, most sophisticated processing for dealing with novelty has been compromised, has been reduced. It makes sense. It confirms the concept. Among other things, this is an advertisement for being nice to babies. Delay, as long as possible, any insult to a baby's well-being or sense of safety so that the blue card can be prolonged and held as long as possible. And, you know, here we have an anatomical, physiological explanation for something that we already know through common sense. But we'll find that by having an anatomical, physiological explanation deepens the credibility. It brings it into a field where you could argue with a birthing staff about whether the baby should be allowed to be left with the mom or things like this. You could argue about it from a feel-good point of view or your intuition. But if you can actually say, no, the most important anatomy this baby has is its complete autonomic nervous system in its full range of motion. If you do infant quarantine like you were trained to do, you're going to interrupt the blue card and thereby reduce this baby's wellness. It's anatomical. It'll show up in the nucleus ambiguous, cranial nerves 5, 7, 9, 10, and 11. It will show up. It's rather subtle, but now we have an anatomical basis for something we knew all along. It's a huge step forward to support a change in especially childhood environments such as the birthing room and the schoolroom. Now we could take a moment and validate this idea a little further. I'd love to tell you about the Roots of Empathy program and recommend you go to rootsofempathy.org. In my view, this completely validates Porges' idea, the existence of a third branch that has major high value for overall wellness. Look at all the topics, all the PhD theses that were created out of that one program, finding excellent results in all these areas. Or we could take it a little further. We could say, here's an example of what is happening with people and their pets. And I would be offering to you that any phenomenon in society that's widespread and very popular has an autonomic explanation. It's doing something autonomically or would not have caught on. And that includes just about everything from adventure movies to sports and many other areas. So pets, that's a huge area. And we find, why do children resting against a pet learn so much better? And why do seniors, when you just take a friendly dog into a senior's home, everybody perks up. They start to feel better. Their anatomical, their well-being starts to show improvements. Why is that? It's because it's restoring the highest, newest, previously not articulated, the highest, newest branch of our autonomic nervous system is being pulled back into play. This has been studied in tremendous detail. Here's Harvard, Johns Hopkins, University of Texas. We have tons of material to validate this concept.